just as we were starting to test for HIV, somebody tested positive, and I said, well, you're going to have to go to the university, to the specialists, to take care of your HIV. This particular patient said to me, well, you're my doctor. I don't want to do that. I want you to take care of me. I said, I don't know how to do this. And he told me about a publication called AIDS Treatment News. At the time, it was published in San Francisco, and it sort of talked about what there was in terms of new treatments. At that point, there was just AZT. And I talked to some people who did this work, and they said, well, it's not that hard, you can do it. So I said, all right, I'll do it. I started taking care of both my patients as they became HIV positive, and then some people who came in from out of town and I think didn't want to go to the university and ended up seeing me. I remember very distinctly the first patient who came actually from San Francisco back to his family in Pittsburgh, and I first met him when he got admitted to the hospital. I remember they would put his trays outside of his room. The nurses didn't want to go in. People wore masks and covered their hair and gloves and covered their shoes and gowns. I mean, it was ridiculous. And it was, very lonely for this patient. He was discharged home and he was really basically in hospice. And I remember going on house call and seeing him at home. And imagine this guy is emaciated. He had AIDS wasting and was really very weak. And when I went into his bedroom at home, he had all these pictures of his life in San Francisco before this. And, he was robust and smiling with his motorcycle. And it just wasn't the person I was seeing then, but it was great to get a view of how he was before. And he described how he found out that he was HIV positive. He was, I think, like a recruiter. He had somebody in his office. He was sitting at his desk. He had tested a few weeks before. It took a long time for these tests to come back. He gets a call with a client in the room. He picks it up. The doctor says, I have to tell you, you have AIDS, and get your life in order. You're going to die. And just his describing that and not knowing what to do with the patient, the client in the room, and it was just sort of heartbreaking. I went to medical school intending to go into public health, to become an epidemiologist. I was advised to go to medical school first, and then I got distracted by I like to take care of patients, and so I didn't really do public health. And my last year of medical school, a good friend who had been an exchange student from Peru came to visit again to the United States, and he came to Philadelphia where I was in medical school. And we took a bus into Center City, and he came out to me, and he said, I don't think you're going to ever be my friend again. He just couldn't imagine that it would be acceptable. And for whatever reason, it was totally acceptable. He died of AIDS early. And I think probably Cephi's influence is a lot of why I went in that direction. But I'm really glad I did. It was a really important part of my career.